So good morning, everybody. Welcome to the Social Housing Roundtable. Nice to see some familiar faces and some new ones as well. My name is Matthew Baird. I founded these a couple of years ago during the pandemic, and they've grown into this phenomenal community of people that we've got now, over 500 people on the mailing lists and things. So nice that every single week we kind of get a different collection of people depending on the topic. These are kept free. I like them to be an inclusive space for anybody and everybody to share thoughts, opinions. And so all I ask is that everybody is respectful of everybody else, which so far 99.9% of the time everyone has been, which has been great. They are funded for free by my recruitment company. So I set up on my own just over 2 years ago now, specialising in social housing recruitment, doing a lot of executive work, but kind of a lot of managers and senior managers as well. So if anyone needs help, please reach out. It's why I can keep these free and keep them running for everybody. Now, I got a call a few months ago now from Oasis Housing because they've been doing some amazing work with homelessness, trauma, and everything that kind of went into that space. And was asked whether or not we could run a roundtable based on the research that's been undertaken on some of the kind of trauma-led kind of thought processes that are being suggested. And absolutely was a topic I felt we had to bring forward. So I'm delighted to welcome Luke Elton today. And the team. And Luke, I'll get you to kind of introduce everybody because you're going to know them far better than I am in terms of everyone's kind of role within the piece. There is a short presentation where he's going to kind of go through the work Oasis have undertaken and what comes next. So if you have any questions during that, please put them in the chat and I'll bring them in. Alternatively, write them down, save them up, and there will be about half an hour, 45 minutes to have a really good discussion about the topic afterwards. So whichever is better for you, please feel free. But Luke, I will bring you in and hope that the sharing and things all works well for you. So over to you.
Thanks very much, Matt. And hello to everybody. It's great to be here today, and I appreciate everybody's interest in the topic, which is, it's certainly been a lot of. It's been a real passion of mine personally and professionally for quite a few years now, and it's great to see that we've got others along on the journey with us. I'd like to firstly introduce Dr. Adele Irvin, who's with us on the call, and I think I just seen Dr. Jamie Harden enter the call as well. So Adele and Jamie, certainly kind of my presentation today wouldn't be happening without both of their work on the project. We asked Adele and Jamie to try and support us in what we thought we knew about trauma and homelessness and its links, basically as a bunch of well-meaning support workers. Not to do myself down too much, but we really wanted to understand the issue. I'll go into that in a bit more detail. Adele and Jamie, they really helped us throughout this whole process, and I'll come to tell you a bit about the research elements of this, and I'm sure they'll be able to contribute and keep us right when I've made mistakes and all that sort of stuff. I've also got my colleague Ben Johnson on the call. So hello to Ben. Ben works for our communications team, and part of what this process has been about, and it's not the part I'll focus on today, but part of what this process has been about public facing advocacy, really trying to push on systems change. So I'll talk a little bit about that, but I know really we're quite interested in what some of the learning's been and what it means for us as practitioners, as landlords, and all the rest of it. So I've got a presentation to share with you all. So I'll endeavour to do that. If you bear with us a second. Can people see my screen there now? Yeah.
All good, Luke, all good.
So the title of the presentation, Tackling Trauma and Ending Homelessness. I'll start a little bit with who we are. So we're Oasis Community Housing. We're a charity that supports homeless people experiencing homelessness in all its different expressions, really. We support people who are rough sleeping or at risk of sleeping rough. Some of those have been rough sleeping for a lot of years. Some of it's new, more episodic. We also support people who might be more kind of transactionally homeless, you might refer to them as. So people maybe living slightly more mainstream lives, but have have hit hard times due to things like relationship breakdown, rent arrears, financial difficulties. We also support people who are in need of housing due to particular needs, whether that be in family stuff. So we run some mother and baby accommodation, which is really geared at supporting families and trying to keep families together where that's the right thing to do, and you know, supporting transitions if it isn't. And we also provide a lot of support around some of the areas that we know linked to homelessness. So we've got domestic abuse service running in Gateshead. We know that domestic abuse, especially for women, is an important precursor of homelessness. So we do work in that arena, and we've also got our Aspire teams, which do work around employability and well-being stuff, particularly as related to employability, and also financial capability stuff. So we've got most of our services up in the northeast, but we've also got an accommodation service in Southwark in the southeast, and a new one that's just opened up these last couple of months in Peterborough, which is housing Ukrainian refugees. So that's a little bit about who we are. I mentioned that we're a charity. We've been on the go for the best part of 40 years now under different names. But you'll imagine in all that time, we've met a lot of people who have had a lot of difficulties with homelessness, never been far away. And we've also experienced a lot of difficulties in that time, trying to help people in the best way. So getting into kind of advocacy and research was quite new for us, really. I mean, we'd participated in research opportunities before, but we'd never really led on one ourselves. So the way this all started, and I was a member of staff working in front-facing services at the time, looking after an accommodation service in Gateshead, Sunderland and South Tyneside. Senior leadership went round speaking to staff and said, understood there was an appetite to push for some systems change and try and understand an issue in more depth. We asked our staff this question: what would make the biggest difference to our work if we could change it? And the answer, I know the answer that I gave at the time, and the answer that a lot of my colleagues gave, was trauma, and better responses to trauma, better understanding of trauma, and trauma-informed, trauma-designed services. And that was that really came out of a lot of collective experience of seeing things go wrong and struggling to support people. You can see some of the quotes that some of my colleagues will have given at the time. One that jumps out at me there is everyone who worked with experienced some sort of trauma, and we'll come on to that in the research. And I know probably all of us in this group today will recognise we've had traumatic experiences. I think what this quote kind of speaks to is the really complex and severe and long-term stuff, particularly when coupled with other vulnerabilities, like maybe not having a supportive family, or not having a home, or having kind of other related issues that make navigating that trauma really difficult. Another one that really stuck out to me is we don't want to deliver stick and plaster services. I mean, as a practitioner, I've been really conscious a few times of how limited I've felt the impact to be, and I'm sure that'll resonate with other practitioners on the call. It can be giving somebody accommodation, even with really good kind of resettlement support, with all the attributes that should have. I've seen it go wrong many a time, and you know how people can struggle to make use of that service. And often we found that people were telling us they related that back to the trauma. So that felt like it was the issue that we wanted to look at. When we're speaking about trauma, this is that you find there's different definitions that anyone could use. This is the one that we went with, and this comes from the SAMHSA definition over in the US, but we're talking about here an event, series of events or set of circumstances that individuals experience as being physically or emotionally harmful or life-threatening, that have lasting adverse effects on their functioning and mental, physical, social, emotional, spiritual well-being. So that brought us on to wanting to do some research to start understanding the issue and what it was actually meaning for the people in our services, and therefore what it had to mean for us as an organisation in supporting people that brought these challenges with them, and also what we wanted it to mean for wider society and that wider kind of social, governmental, local and national response to the issue. So just to briefly introduce the research, and this is where Adele and Jamie can hopefully keep me right, is I can talk briefly through the methodology. I'll start with the aims, given that's the order on my slide. We wanted to assess the prevalence of trauma among those experiencing homelessness in England, examine the evidence regarding what works in supporting those with both experience of trauma and homelessness, and use what we learn to support the development of a set of policy and practice recommendations. So you'll understand that the policy stuff was, a lot of that was looking outwards, and a lot of the practice stuff was looking inwards as well as outwards. So the methodology of it, we had a couple of kind of data sets to either go and get or to use. So one of those was led by ourselves, and we had kind of in-depth supported interviews captured on questionnaire documents with people accessing our services. So that analysis of 115 questionnaires completed, we did those between the period of April and September, and 115, I think we probably started maybe slightly later than the April, and the April was around piloting and drafting. I think we probably had about three and a half kind of months actually doing the engagement. 115 represents about just under a fifth of the people that we were working with in that period. A little bit about that methodology. It was very much opt-in. It wasn't anything that we were forcing on anybody, recognising there being a certain irony in wanting to do some work around trauma and campaigning about trauma. And we recognise that engaging around this issue can potentially be quite traumatising and triggering if done in the wrong way. So we didn't want to, we quite deliberately didn't want to force that issue. But we spoke with people coming through our services about their experiences, invited them to share. It was very much the approach taken. We got a lot of qualitative data generated and quite a bit of quantitative scaling type stuff as well. So we asked people to use the definition of trauma that we'd supplied, but really to own their own experiences and withhold what they wanted to withhold and answer what they wanted to answer. But tell us how they defined their experiences as well. I think what that meant is we probably did get a slight underreporting of some issues, because we found that people who disclosed stuff previously in some of our communications with them didn't repeat it in this engagement. But the advantage of that is I think we gave the people the power to kind of control their own voice and what they wanted to share, which felt like the best thing. The research was also based on a review of the repository of the Fulfilling Lives national research programme. So if any of you have heard of Fulfilling Lives, it was a big lottery funded project, worked over 8 years across multiple sites in England. So there was 8 different sites. Newcastle Gateshead was one of them where we work. There was a lot of data generated from that engagement. It was as much about learning as it was about delivering support. There was a lot generated from that, and that was going to be looked at through this research as well. So all the kind of everything that you see kind of reflected is based on those things. A little bit about the people who responded to our survey. We had, I mentioned a bit about our geography and where we're based. We had 3/4 engagement services in the North East, which is the bulk of our services, an additional 1/4 in London. over half respondents aged under 35, therefore just under half over. 54% male, 43% female, 3% identifying as non-binary. Predominantly white, although in London that picture is quite different demographically. Our residents in London tend to be from minority ethnic backgrounds and tend to be younger as well, because we run in young people services there, and they'll have slightly different experiences that we'll come to reflect shortly on. The majority of people are accessing crisis support, so that's through our drop-ins, through our outreaches, or through our supported accommodation assessment centres, that sort of thing. Some of those people will also have been living in other hostels or temporary accommodation. Those are the bulk of people. In terms of the character of people's homelessness, we found that the main number of times people had been homeless was 3, and the main length of time that people had spent homeless was approximately 2 years. You'll imagine there was quite a lot of variation, between different experiences of homelessness amongst the people who contributed to that. Some people talking about being homeless for decades, other people it's been really episodic or very short term. The key findings really emerging were, and that this was the kind of really important part of the campaign, is that we kind of, and summarise, and we cannot solve homelessness, and particularly entrenched homelessness, unless we adequately address trauma. So we found that 94% of the people who reported experiencing homelessness in our study had also experienced trauma. Now this is where it's particularly significant as well. 63% reported experiencing 4 or more incidents of trauma, or trauma over a prolonged period. What we can talk about as being complex trauma. I mentioned before, due to the methodology, we probably did have a slight underreporting, and not everyone will always recognise an experience as traumatic. But some of the key stuff that was being shared was around psychological, physical, sexual abuse, neglect, whether it was children, familial addiction, bereavement, local authority care. I don't need to go through all the different types there, but you can see there from some of what's written down, there was some really heavy duty stuff that was reported in a lot of detail. We also found that trauma, people regarded that trauma was affecting the pathways into homelessness. So 65% of people linked trauma and its impact to housing difficulties. It's both a direct trigger and a risk factor. So we also found that homelessness itself was a source and a form of trauma. So that could include as well experiences of engaging with services. So some of the qualitative stuff we had coming out of the research around this was really about negative experiences, rough sleeping, and the vulnerability that comes with that, but also challenges making use of hostel accommodation, and living in challenging environments that people might not be used to, or that they are used to and find re-traumatizing. The research also in this area spoke to cumulative effects of repeat homelessness as well, and there's quite a powerful quote there. Someone really trapped in that cycle of homelessness. Every time I become homeless, it's traumatic, and it doesn't get any better. Trying to understand what this means for services, we also heard that trauma affected pathways out of homelessness. 35% of people in our engagement telling us that they felt that trauma was preventing them from moving on. And in terms of the impact of trauma, I'll come on to a little bit more the granularity of that shortly, and what it means for service delivery. But 70% told us that trauma had a significant impact on their life, with a further 27% telling us that trauma had impacted them somewhat. So certainly the lion's share of the people we engage with, when asked that question, really understood that trauma had a significant impact on their life. Now, one of the most kind of powerful and in some ways useful for service delivery findings from the research was what people told us about the granularity of the impact of trauma. And going down this list, I'll not read all these out, but you can see for yourself. There's a high prevalence for which people have reported that they're feeling that trauma and the trauma they've experienced in their lives has led to subsequent difficulties. So we'll all be comfortable, I think, on this call, that a lot of these impacts will become risk factors for homelessness, or will impact on people's ability to make use of a lot of the support and systems that are in place. So just to give an example, 72% of people experiencing trauma telling us that they felt that it had led to difficulties managing relationships, and 67% telling us that it led to difficulties managing emotions. Anyone who's ever kind of run accommodation-based services before, especially shared environments, will empathise that having a lot of people together who struggle to manage relationships, asking staff to relate to them and asking them to relate to staff, and then adding in arguments and difficulties managing emotions, you've got really quite a challenging situation, especially when adding in some of the other kind of system generated stuff around short-term tenure and all that type of stuff. We also found, and this is the bottom bullet point here, a positive correlation noted between the number of traumatic experiences and the mean number of impacts of trauma. So broadly, the more traumatic experiences recorded and reported, the greater the likelihood that people were telling us that they were experiencing these impacts as a result. So that about brings me to the end of the research aspect of this. I don't know whether Jamie and Adele would like to make any comment on that, or I think there was anything. It's important for the room to kind of know in addition about the research.
I'll come in first, just with a few comments.
Thank you, Adele. Nice to have you with us.
Oh, no, thank you very much. Yeah, just a few things. I think one is that that kind of figure of 94%, and the critical thing there, as Luke had said, was that 63%, that trauma that people experience was multiple, it was prolonged, it was complex, and it was very severe in nature. So we had quite a lot of quotes and things where people were talking about parents having mental health needs, but those mental health needs were extremely severe, to the point where parents had committed suicide and things like that. So in the qualitative data that came out, it was very clear that these were quite extreme experiences that a lot of people had had. I think another thing really is around that discussion about kind of moving on from homelessness, and people in a related study that we did just before this, people talking about kind of having unresolved needs around trauma, and going through the kind of the support accommodation system, engaging with services, feeling or seeming that they were ready to move on. Support workers thought they felt ready to move on, then they were moving into the accommodation, and then living independently, and something happened which sent them right back, and they just went straight back to those kind of previous traumatic experiences. And so I think that's it's then really difficult to think, okay, well how do you really understand if someone's kind of ready to be moving on, or they might look like they haven't got particular needs, or kind of very complex needs anymore, but actually they may still. I think another thing is really around that idea that trauma was quite gendered and sort of cultured in nature. Women reported were more likely to report kind of more experiences of trauma, greater impacts of trauma, different types of trauma. those who, you know, their immigration status, those who had applied for asylum, had obviously had very, you know, all reported having had traumatic experiences, but those experiences were very different in nature, quite understandably, to those who had sort of, you know, been born in the UK and grown up in the local area in which they were engaging with services. So again, it's that kind of level of complexity about understanding everyone as an individual, and everyone will have different needs. And also, I see in the chat there's quite a few comments around ACEs, which is really important, and I think there has been a lot of discussion around trauma, childhood trauma and homelessness. But in this study, 60% of individuals reported experiences of trauma during their adolescent period of life, and also in adulthood, kind of respectively. And so I think it is just that real important reminder that actually trauma can occur at any stage in the life course. Those traumatic, the nature of those experiences will be different. And so I guess even if we're, you know, engaging with adults, it's very possible that they, you know, are currently experiencing a range of traumas, or have recently experienced a range of traumas, even if the kind of needs might, or the discussion might be kind of centered around adverse childhood experiences. And I think the last thing is just that, I think, you know, again, just picking up on what's in the chat, that I think, or quite possibly, you know, when you're engaging with those who are experiencing homelessness, obviously you want to deal with the trauma that kind of led them to be homeless. But I think that quote, as people have said, that every time people become homeless, and, you know, many people in the study had been homeless multiple times, you know, that in itself is a very traumatic experience, and it happens over and over again. So yeah, just agreeing that was very powerful. And I think that's
very much, Isabel. That's amazing. And I think, you know, I know someone had put there that there was a recent study that 96 people going through the homeless gateway had ACEs, or trauma in childhood. And I think some of the points you've made there were really, really interesting, because obviously a big part of this is that people don't understand that some of their experiences are even traumatic. They don't, you know, it's that kind of understanding in itself. And Jamie, I know you've come off chat too, so please provide some insight, because I imagine this was a fascinating study to undertake.
It certainly was. And I mean, one point to make sort of huge credit to Oasis to get such a good response rate. I mean, to get a response rate of 20% among this particular group, often where you're having quite fleeting contact with them, I mean, really is a tribute to the work of Oasis, and gives us some of the strongest evidence in this area, where we haven't had anything like such good response rates in previous surveys. I think another thing that was highlighted was perhaps that very much picking up on what both Adela and Lucas said, that early adulthood seemed to be a particularly difficult time in terms of trauma. That we had a lot of people aged under 30 who said that they'd experienced trauma as an adult, and quite significant trauma as an adult. So just picking on that point about the life course, sort of young adulthood did seem to be a period in which a lot of people had experienced some pretty difficult traumas. So I mean, it really was something that's happening right across life's course, certainly childhood, but sadly adolescence and young adulthood in particular as well.
Amazing, thank you. I'm going to take off the screen sharing so we can kind of see everybody's in the room, and I can kind of bring in now to more of an open chat. As I put in the chat there, if anyone would like to come in at any time, please use the reactions raise hand symbol. I'll bring you in. A few questions that came up in the chat just while we're who was the volunteer to go first. It's always interesting. Jenny Blake, I think this is fascinating. We all know that these links between ACEs or trauma significantly impacts on likelihood of homelessness. That in itself isn't necessarily new, but raises some great questions around how we support people experiencing homelessness. And this will be something maybe, I don't know, Luke, I know when we were speaking before about how this method is really impacting services. Should it be support first, then housing? Should housing come first, then support? Or do models of housing first really work if an in-depth trauma-informed support is not inbuilt? And I don't mind whether Jamie or Adele or Luke wants to come in on that.
Yeah, I mean, I think probably just picking up on what Jamie and Adele were saying as well. Certainly, like experience kind of supports that understanding that there's homelessness itself and engagement with services trying to alleviate homelessness can be traumatizing and re-traumatizing on their own, and certainly I've spent quite a lot of my time in working in front-facing services and patching people up in the immediate aftermath of a serious traumatic incident. I mean, we're never far away, especially if people are, you know, in chaotic substance use or vulnerable. People are never, unfortunately, that far away from another traumatic experience to add to the collection, whether that's kind of physical beatings or, you know, ongoing abuse, exploitation. It's stuff that we see quite regularly in people who are in that vulnerable position, and it's stuff that we can see happen to people even when they get what looks like on paper a good service, the opportunity of a safe and secure house. And one of the impacts there that I think is really important here was around that people telling us about trauma, linking trauma to self-neglect, and it actually, you're right, Matt, not being enough to give somebody a set of keys or even just give them a support relationship on its own and say, right, you do the rest, because I think experience tells us that that isn't likely to work. So I think certainly you need both things, and I think you need to recognise that accommodation, moving into accommodation actually can be a real point of difficulty for people as well.
Well, particularly with, I mean, obviously, look, I know yourselves are in the North East. I'm Birmingham based, and with all the issues that we've had over the last few years with the exempt accommodation model and everything that's gone into it, I'm the chair of the Exempt Accommodation Forum, which is a forum of kind of managing agents that comes together every couple of months. And speaking to a lot of managing agents who suddenly have had someone who's arrived who's already been through 3 services that were badly run and everything else, you're saying kind of 4 or more, you know, that more can be a lot more than 4. And I think that's something that we can definitely mention there. And
yeah,
you know, they can arrive and kind of be like, right, I've been through 7, 8, 9 services now. I'm going in immediately knowing this is going to be awful, but it might not be as awful as last time. But then why would I? And the cycle of that real kind of letdown is really worrying, I think.
Yeah, I think it's something we've got to be really reflective of as practitioners and services. It's like what's people's experience has been up to this point, and I know, you know, we try to always approach something like a move-in with enthusiasm and with compassion and care, and recognizing that it's a really important point of reflection actually, that someone, you might be quite pleased to see somebody in big beaming smiling faces, but for the person coming in, that, you know, might be one of the worst days of their life, or they've just had a few of the worst days of their life built up together. So yeah, I mean, there's definitely something about that that whole kind of radical welcome and how you kind of introduce people to your service. But there's equally something that can be quite difficult about overloading people. I mean, I've unfortunately kind of literally seen people abandon flats due to that kind of fear of responsibility and the pressure of like having a washing machine and not knowing how to use it, and not feeling comfortable with authority, with relationships
and then on top of it, you've got the cost of living crisis and everything else going on. It's just, it adds up and adds up. I'm going to fly through a couple of points in the chat and then bring in Kate. Actually, Kate mentioned earlier, housing first can work, but should be a health-led model. We use it as a housing-led model in the UK. But if you look at Canada, they utilise it as a health-led model run by health professionals in housing as a wraparound service, which is amazing to hear. Darwin wanted to dive back to, but wondering if research touched on the relationship between psychologically informed events and support a trauma-informed approach. So we'll definitely come back to that one. Viv links to the Tier 1 approach and Maslow's hierarchy of needs. Guy needs to approach safety, build, trust, offer choice and collaboration the service of their needs and building empowerment and resilience. There are programs that build on this, i.e. supported housing, and refugees have and are still working on developing approaches. Needs experience of working with people experiencing homelessness don't generally call their trauma. If you say that, they may not recognise, acknowledge, or want to face it. And as someone else has pointed out, that's the same in many of us. Language and word use is important. I'll come back to some more in a bit, but Kate, thank you for joining with us today, and do please come into the chat.
I really just wanted, I mean, it's a great piece of research, fantastic, and as Matt will tell you, obviously anybody's ears off about trauma-informed homelessness. I think it's absolutely the hub of what's there. How are you finding when you are relating to other services though? Do you find, Luke, that you're actually getting that same buy-in? I've just finished a project in Manchester, which is aiming to become the first trauma-informed city in the UK. And they've got a lot of trauma-informed training going on, but we still find with things like mental health services, if people don't turn up, they're discharged after a couple of visits. So we'd actually gone through the homelessness mental health services who kind of understood the trauma. But I think it's that point, isn't it, that if somebody looks ready, but actually then they hit another crisis point, is that just going to engender more homelessness, or are there other services that are either going to be able to say, yeah, we understand this and we can see your notes, so you don't have to tell us all again, another one of my passions? Or is it, that actually they're just going to say, well, actually they're not engaging now?
Yeah, thanks, Kate.
Sorry, there's loads in there, but
No, I mean, speaking plainly, I think trauma-informed care, trauma-informed practice is it's become its own little buzz phrase, hasn't it, as well? And so that there's a challenge in, I think, have organisations always considered the full extent of what this actually means? Because you're talking about something, if you want to genuinely be trauma-informed as an organisation, you're talking about having to balance quite a lot. It's quite a difficult task potentially. I think what we see is that there seems to be a lot of enthusiasm from different partners to open those discussions, but I think you're right. When in my experience is somewhat similar, when it starts getting difficult, people can kind of pull back a little bit from wanting to commit fully to that. And I mean, some of it is really hard, to be fair, as well. We can take a really trauma-informed approach to understanding like the roots of antisocial behaviour, for example. But you still, if you're a landlord, you've still got to balance that understanding and your ways of working with the kind of needs of the community and all that sort of stuff. So some of it is legitimately really hard. I think there's an additional challenge related to it as well, in that in getting staff trained in trauma-informed approaches is the easy bit. And if you've got staff with the right, that are naturally receptive to the approach, then that's a real head start. But actually there's something really important about ongoing reflection on skills and behaviours. So that's something we've tried to really deliberately do on the back of this, is kind of redouble our efforts on reflective practice and do it with a bit more intent and purpose, and try to bring in this kind of how do we manage relationships, how do we support, how do we work in a relational way with people who are telling us that they struggle to manage relationships, how do we avoid that, how do we manage conflict and aggression in a way that's trauma informed, and some of it's quite obvious. We're not going to the staff, we're not going to square our chests and and start shouting and pointing our finger to make sure that now we're not scared of them and all that sort of stuff, which can bring out the worst in somebody and elicit that kind of challenging response. But some of it's about just how do we use boundaries to kind of support people to feel safe, and how do we kind of pull back on some of our instincts to just support people better, when it actually we can all have been guilty of that sometimes. Please stay, please don't disengage from us, I just want to make you feel better, when actually what could that mean for the person whose background, the traumatic experiences has been about that loss of control. And it's actually some of that stuff, it might feel naturally instinctive to people who are who want to be kind to people, to kind of try and keep them close, and I will support you, I'm here. But actually people need that ability to leave and to know how to come back. So it's really fundamental, I think, for all aspects of it's policy, procedure, but it's also like what you bring with you on the day as a practitioner and how prepared you are to be reflective about it. So it's an ongoing massive piece of work, I think, to sum up that long-winded answer to your question.
No, and I think it picks up the next thing that I was going to say is our staff vicariously experience this trauma, and so actually having a trauma-informed workplace with lots of reflective practice and stuff like that, and I often find that my staff have had trauma in childhood or adolescence, which is what attracts them into this work. So actually the other flip side of it is we have to be really careful about how we manage our staff, and I know Matt and I have had conversations about burnout of staff and how we attract people into the industry, etc. So I think that's the flip side of it, and fundamentally it needs a huge change across homelessness that is not going to be a quick fix. And unfortunately, I don't know about any of you, but my magic one's out sparkles. So
it's funny you mentioned that about burnout, actually. So Jenny Blake, who's actually on the chat today, unfortunately in a hotel, so I know Jenny can't always jump on the video, but we ran a roundtable back in December about burnout in housing. And I think one thing we have to realize is that even you've talked about your staff there going in and whatever else, that in itself, going in and experiencing a day in life of a homeless hostel for some people, you can have a very traumatic day and you carry that with you, and that trauma, the job itself can be traumatic. So it does take me back to Claire Dowan's point, which I definitely wanted us to touch on, which was that relationship between psychologically informed environments and supporting, this trauma-informed approach, which obviously we need to do. But that quality of housing we provide and the types of housing we provide, there's so much lone working goes on. There is, some places don't provide enough training in terms of how to actually go in and support anything and everything you're going to see. I mean, I don't mind Luke, Jamie, Adele, in terms of this part about the types and quality of housing provided, did that come up often on the study itself? I think Adele's on mute and Jamie isn't, so I don't know. I can see one of you is going to go. I don't know if I can unmute. I can ask you to unmute. That's about all I can do.
Right, we're unmuted. Jamie, do you want to jump in there first?
Just, I'm going to think. Obviously, the quality of housing will be an issue, and I think a lot of what we found around emotional regulation, what could be tied to sort of the housing environment that people went into, and that clearly the more difficult the housing environment, the more difficult that emotional regulation was going to be, and certainly another point that's been made before, that in other studies we found sort of that people can be rehoused into situations which don't really change very much. They still have the same pressures on them, the same people knocking on the door. I mean, one of our previous colleagues had a fabulous picture of somebody, well, not a fabulous picture, an awful picture, but very effective illustration of somebody, what he called sleeping rough in a flat, whereby his sleeping bag was in the middle of the living room floor, and the only real difference was that physically there was a roof over his head. Otherwise, it was very much the rough sleeping experience. So, yes, I think everybody would like very good houses in nice areas for their clients, and where that's not possible, that does have a huge impact on people's ability to overcome both homelessness and trauma.
Mm-hmm. Yeah. I mean, just to add to that or echo it largely. It wasn't too much a focus of discussion of the research, but people certainly alluded to, the types of environments that they're living in, and then their kind of well-being at their time and their ability to move forward. I mean, people talked to that particularly in terms of domestic violence. So if people had experienced domestic abuse, of course, being in the hostel was very difficult. They talked about that lack of trust, kind of living in fear, the kind of chaotic nature of the environment. People talked a bit about, carrying that fear from the sort of family home with them in terms of the location, so that, being very worried to kind of disclose or leave the hostel in case people kind of found out where they were. So, continue to live in fear. this, you know, as Jamie said, the study that we did just before this, which was kind of much more focused on housing and sort of people's kind of experiences leading up to that. People were talking about moving into housing first accommodation, but it was, as Jamie said, it was near other individuals who'd kind of moved on, who were also in housing first. So they didn't really feel like they'd moved on, wanting to live in particular areas, but actually it was very difficult for providers to source accommodation in those particular areas. So it's just a really difficult kind of situation all round, balance and kind of what's available with what will fit everyone's kind of bespoke needs. And just picking up on the point that was said before, I think what you were saying, Kate, is really important about this thing of, you know, service users will exist in a system. So, you know, if we want to get this right, it's not just about homelessness services, it's not just about the kind of the hostel environment, it's about having a trauma-informed system as a whole. So when individuals are engaging with mental health services, or they are engaging with criminal justice service or social services or something, everybody who is involved with that individual really needs to, or it would be ideal if they adopted that trauma-informed approach, because otherwise the trauma kind of will just continue when they leave the homelessness service. So, you know, in this study, people talked a lot about mental health, whether they had or had not accessed specialist mental health services. And there was a lot of kind of very well-known barriers to access and engaging effectively with kind of mainstream mental health. I guess one of the big things that came out of the Fulfilling Lives sort of rapid assessment of evidence was all of the kind of bespoke interventions or interventions linked to kind of broader systems change that services were doing to enable people to access that specialist mental health support, whether that be services being kind of in reach to hostels or visiting people kind of elsewhere in the community. And that was really important, but it was kind of all workarounds and add-ons rather than just a different kind of more flexible mental health system. So it's kind of, you think, is it about changing the mainstream system? Is it about having different types of services? Or how would you make a trauma-informed system as a whole? And that's a whole other kind of ball game, isn't it, to provide and, you know, trauma-informed training to housing providers, support workers.
Absolutely, and as I said, he's just put in the chat there, this is our area of work, staff experience of trauma. We cannot work in a trauma-informed way if we don't recognise the trauma we experience ourselves, but there is also a high number of staff in the sector who have lived experience of trauma themselves, and it's part of the reason we're drawn to the work, which I think was the point that Luke made as well before. It's so interesting. We want our service users to acknowledge their trauma, but don't always recognise our own. And anyone who missed, I know kind of plugging previous episodes, are all on YouTube. And last week we had WHG, Walsall Housing Group, come online talking about lived experience and the importance of having people who've got lived experience in the sector and how they've really empowered their teams to utilise that lived experience to better support people in social housing and service users. But as Jenny's pointing out there, that's as long as it's in an environment in which they are also kind of their own trauma is protected and supported in that way. Jimmy Harding's made a really interesting point in the chat there. So based on some quick calculations on the data set, where we were able to identify earliest life stage of trauma. In 51 cases, it was childhood. In 27 cases, adolescence. And in 24 cases, adulthood. I think that probably says an awful lot about some of the conversation we're having today. A question from Grant. Again, don't mind who would like to jump in on it, really. What do you think we can do to support changes in the environment of hostels? Someone has put me a comment, of hostels and temp accommodation. In effect, looking to create a more recovery type culture in a generic mixed environment. The reason I've been thinking about this question is there is some work we've been doing in the north of Wales using the outdoor adventure as a means of support. Through these programmes, communities, friendships are formed, and the conversations between the service users change, and they can become more supportive and encouraging of others. Because I don't know if this is something you're already looking at, because evidently you're trying to lead in a very trauma-informed way, but the changes in those kind of hostels and temporary accommodation across the country are absolutely vital, aren't they?
Yeah, I mean, thanks for the question, Grant. I think probably in your reasoning for thinking about it, you're probably arriving at partly what you can do about it, I think. So I think it is about the environment, and different buildings. Obviously, we've got to acknowledge different buildings have like different levels of opportunity to. So we've got a shared house that jumps to mind, an assessment centre. It's for people with high levels of need, often high levels of risk coming with it. The idea is it's somewhere to settle, steady yourself, and then move on into longer term accommodation. So on paper, kind of 6 fellas living together in a shared accommodation setting with staff on site is something that could be quite challenging to manage, and sometimes it is. But we try to make best use of that lived environment as somewhere for, I guess, co-production in its broader sense to occur, so that there is something really quite important about how people use the facilities of a building, I think. So, and it doesn't need to be rocket science. Sometimes it can be, making the tea together, or making a cup of coffee together, or watching the telly together potentially. So what we've seen in one of our buildings, 58-7 project, is it started from looking a little bit like an IKEA show home, and it was kitted out with all furniture, but it was in our style. And gradually, what we found is, that the residents who've come and gone in that time have put more and more of an imprint on it, and they're bringing their own sort of focuses in on it. And I think the feeling of that house has been, it feels like a house, and it feels like people have that opportunity to live quite communally in quite a healthy way, if that's what they want. I recognise we're talking about a small scale hostel there, and that maybe becomes a lot more challenging in a big one. But some of the other stuff, that building isn't perfect. Private space is at a premium, but what the building does have is it's across the road from Saltwell Park in Gateshead, so it does have an opportunity to think about, as a worker, if you need to have a private conversation with somebody, you can find that actually in the community sometimes. And have you got that opportunity to leave? Depending on your service setup, you might not. But how do we take things out of the environment as well, which I think is partly what you're saying in the second question. So I think that there's something about policies and procedures as well, about how in the people accessing services tend to be just so perceptive of how they think other people are feeling about them. So every response counts, and I think we all need to be mindful of kind of how we communicate, the words we use, and how we relate. It's a two-way process. It's not just about someone behaving themselves and we talk on them and telling them what to do. It's about how do we actually how do we make that cup of coffee together in the kitchen? And some of it's really basic. How do we contract around me coming into your room? What do you need from me as a worker? For that to be, for me to get the best out of you, rather for us to get the best out of you, and not do further harm, because I'm sure you'd appreciate I've certainly seen it all go wrong just for somebody knocking on the door in the wrong way, or not ringing in advance or whatever. And speaking of some of the system stuff, we did have some sort of system focused recommendations that have been part of the advocacy campaign that this has been built on. So without going into too much detail for all of these, you can find out more on our website, by the way. But one of the things we felt was important for the system to do to respond: establish minimum standards for the delivery of trauma-informed homelessness support services. So that was really about developing a framework in partnership with the homelessness sector, so we can start addressing that question, which we've kind of touched on today. It can be quite difficult. What does good practice look like? What does trauma-informed practice actually look like? What are the features? We also spoke about developing and rolling out a suitable training programme to support providers and local authorities to work in this way. And then a longer term ambition, once those things were in place, it was about asking local authorities to commit in terms of their commissioning and the funding of services that are designed in a way that is trauma informed.
I'm really glad you brought that up, because that was a question that just come up, that's sparked a little bit in the chat there, which was that whilst relationships are key to change, we're driven by a commission-led environment, and commissioners often want hard outcomes, not relationships.
Yeah.
And that balancing a person-centered holistic solution with the financial boundaries of central local government services is increasingly difficult.
Yeah, really, really difficult. I can't shy away from that on this call. Some people, some commissioners will be more on board with it from the outset than others. There's something important about, I think, how we communicate added value, where this stuff isn't necessarily always like easy to see. So, you know, if you've got like if your move on rates don't look brilliant, then, you know, what can you be in a position to share about your impact in terms of well-being and the kind of quality of sustainment and all that sort of stuff. So it is really difficult. It's certainly something to balance in terms of commissioning.
And like I say, it probably depends on which commissioning service you get. But there's, as you said, I think if there is part of that training that you're talking about, and part of that can be about how you've built your relationships with your commissioners, I only think that can be a benefit. I'm aware we've got a couple of minutes left. There was a couple of further points in the chat, which I'll dive to in a minute. But Kate, do please come in. I want to make sure we've got as much conversation as we can.
I'm soapboxed out. So
this is one that could have run for an hour and a half. So don't worry.
Easily today. So just a couple of points is many local authority housing strategies are up for renewal in 2025. So it might well be that as housing providers, especially those that work across multiple LAs, there is something to be able to say that, you know, we could be able to look at something trauma informed, and just picking up as well how we substantiate those softer skills that we bring. So we actually, in our KPIs for our commissioning, we actually put in a value for our social impact. So we will add a value in for the reduction in blue light services. We will put in a value for stuff that we've done within the communities. We've put in a value for the amount of grants that we've got, for move on where we've got grants, where we've reduced move on rates, that sort of stuff. And actually that has swung commissioning bids for us in some places, because we're never going to be the cheapest, we're never going to be £2.50 in a bag of beans, but actually the social impact that we can provide to the community. And again, we've picked up on it sort of slightly here, that actually it's about us being a community, because all of our services are in a community. And in my experience, communities are often, they're very, very willing to take people that have a lot of trauma and to amalgamate them into that community, as long as they have sufficient support. So more than happy to talk about that to anybody as well.
Thank you so much. I know a couple of people have had to go because it's time, etc. Last kind of couple of points made in the chat were that small spaces are so necessary. So many service users I've worked with have been kind of basically been warehousing people and HMOs and the struggle around those. And organisations are expected to deliver high quality trauma trained staff, or simultaneously not being able to pay support workers much above the living wage. And that whole piece around salary, I could absolutely get my own soapbox, Kate. I can absolutely promise you that for many, many hours. I'm aware some people are having to go, so I do want to make sure we end this on a bit of a high. To Adele, to Jamie, to Luke, thank you so much for bringing this to the table today and for all the work that Oasis put into it. And thank you for reaching out, because it's an imperative service. I'm certain there's a follow-on that we can get from this, and it'll be really interesting to hear kind of where everything goes next. Are there any final points, Luke, you'd like to make just before we round up today?
Just to encourage anybody, thank you everybody. Thanks Matt for bringing us along, and thanks Adele and Jamie for coming along with us today. I really appreciate that. Thanks for everybody's input. If anyone has been kind of moved to find out more about the advocacy side of this, you can find the details on our website. Obviously search Oasis Community Housing, trauma, homelessness. You'll find a link to somewhere you can sign the pledge to try and push on those system change stuff that we've asked for. We launched this in Parliament actually in November last year, so we're keen to try and have the maximum impact that we possibly can, locally for ourselves and services, but nationally if we can. So, you know,
well, if you share that link with me as well, then I'll make sure that gets circulated. That'd be amazing.
Thank you.
And I'll be kind of tagging people onto LinkedIn so you can connect with each other as well. Next week on the roundtable, we take a slightly different stance, as everyone who's been to a number of them know before. We discuss anything and everything on these platforms. And next week is Windrush. So we've got Professor Patrick Vernon coming along to talk about Windrush and its relationship with social housing. So I hope a number of you can join there. If you go to linktree/the SHRT, that's RT, then you can find the links to sign up and register and find all of the recordings on YouTube. Until then, thank you to Luke, Adele, Jamie, everyone connected with the Oasis project, and I look forward to catching up with you all soon. Cheers.
Thanks very much, everyone. Thanks.